everyone being here today to mark this important milestone by Narayana Health. 100,000 neuro procedures. It's a significant achievement, and I'm glad to be here to share this moment. Also, as an ex-patient, I would say, of Narayana. Just to share my story, I was driving one night from Goa to Bangalore. At around 2 o'clock in the morning, I just felt very, very tired, and I found a difficulty in movement. So my family acted very quickly and took me to a hospital. And a scan confirmed that it was a TI, reversible thing. So I underwent a carotid stenting procedure done by Dr. Huded, a painless procedure. And I learned that with timely treatment and proper follow-up, these symptoms gradually reversed, and I was able to return to my normal life and to music. This experience made it clear to me that a stroke or a TI is a medical emergency, but it is treatable and it is also preventable if it is caught early. And acting fast really matters. I'd like to thank Dr. Huded, all the nurses and the doctors and the entire team at Narayana Health for the care I received. Their calm and professional approach made a big difference in how I experienced my treatment and recovery. So anyone going through similar situations, don't delay seeking help. Early recognition and timely treatment can change the outcome. Recovery is possible and life can go on. So back to where we were. Thank you so much.
Specifically because we also know that in recent times, especially in the film industry, Salman Khan also got brain aneurysm. So could you please share your thoughts on that?
Yeah, so as I said, it is common, around 1 to 2% of individuals will have brain aneurysm, nothing to worry. So if it is diagnosed early, if you have a strong family history of aneurysms or brain hemorrhage, it can be diagnosed early with a MR, which does not require any radiation or contrast. And if it is significant and depending on the morphology, we can treat early so that we can prevent brain hemorrhage. Always in neurological condition, prevention is best.
Basically, movement disorders in neurology is a interesting field. Here, most of the cases, the MRI is normal. Okay? Unlike in stroke or hemorrhage, where MRI picks up the diagnosis, in the movement disorders, MRI is clean. Okay? So the diagnosis is made only by seeing the patient, seeing the clinical, hearing the history, and examining the patient. So I get a lot of messages on WhatsApp from the relatives group. Can you please tell, doctors have told that patient has Parkinson, but the reports are normal. I told, that's exactly, in Parkinson your report should be normal. Then only you are a Parkinson patient. If the report shows something else, if the MRI shows something else, you don't have Parkinson. So, so one thing is that if MRI is clean and it is not showing any abnormality, patient is having abnormal movements, that is when we decide that this is we call it as primary dystonia. These are the patients who benefit the best from electrode placement. If it is a damaged brain, where you get dystonia because of the stroke and all, these are not very ideal conditions for DBS. DBS, the ideal condition is brain should be normal. So MRI should be normal, patient should have symptoms.
And what is the golden time that you can rush to the treatment so that you can get the best results? So please show some light on that.
Yeah. In neurological conditions, mental disorder is different. This is the brain-related physical damage to the brain. For example, brain stroke. Earlier treatment is better, but we can give when there is a blockage in the blood vessel. Sometimes some patients we can give treatment up to 24 hours. Earlier is better. So it is not golden hour, means we should not stick to 1 hour. Now the window has been extended up to 24 hours time window. And in case of brain hemorrhage, it can be extended more also. So always earlier treatment is the better.
The nature of the symptoms. For example, you have been having some mild tremors on and off and it has been almost same or maybe changed 1 degree, 2 degree over 5 years, then that is okay. But if you find that you are fine at 75, in 76 you are getting some very obvious tremor, please don't take it as age. So I think if there is a sudden change, like maybe within a year also you can take it as sudden. I think a sudden change which is very well palpable by everybody that is a little different from what we used to do, like tremor, and if you suddenly others are noticing that you are not swinging one side of the body, you are swinging only the other arm, consistently somebody is noting, or you are finding that you are falling. This is one common thing which I see in patients. They have explanation for every fall. They will tell this I slipped, that I slipped. They will have 10 falls, they will tell 10 reasons. They don't identify that over 1 year you have fallen 10 times, still you are giving reasons. People don't fall unless they are sick. At least like if they have multiple falls, there is something wrong. So please don't neglect any fall. Try to analyze. If it is very obvious that you have slipped and fallen, that's okay. But otherwise, please take these things seriously. I think this is one tip I would tell to the elderly population, because they tend to trivialize all these things, that sudden tremor, especially tremors, they think that is age.
Very unusual.
Because here it is the cost element, it is variable and it is value based. So we need to consider many things. So for example, depending on the anatomy and all, the cost will vary, and a few of the schemes cover it. So in that way we can do these procedures.